Hello viewers, this is Physio Krina Ved from HealthQ Rehab. Today I am going to tell you what are the reasons you get the Bell's palsy. So according to the research and the evidences, there are actually no causes for the Bell's palsy. The Bell's palsy is in itself an idiopathic condition. That means there is no cause for the Bell's palsy to happen. But there are several risk factors and the triggering factors which causes Bell's palsy. Injury to facial nerve can lead to Bell's palsy. Bell's palsy is a condition where it can happen throughout the lifespan of an individual. Bell's palsy can happen to any individual of a group of age. It can happen to children, adults, and even to an elderly individual. Mainly, the Bell's palsy is triggered by the inherited or the previously suffered from the viral infection. Viral infection can be such as herpes zoster, Epstein-Barr virus, HIV, and also the bacterial infection from an ear, which is also known as Lyme's disease. These viruses have the predominancy to reside in our body. When our immune system weakens, these viruses reactivates in our body, which causes inflammation and hence can lead to the nerve damage and causes Bell's palsy. These days, we have also seen the patients who have suffered from COVID-19 virus infection have developed Bell's palsy. Any middle ear infection can also lead to Bell's palsy. Some of the potential causes is trauma. Any trauma to brain, to the course of nerve, skull bone fractures or facial bone fractures can lead to injury of a facial nerve, which can lead to Bell's palsy. Any tumor in brain from where the facial nerve origins or to the temporal bone from where the facial nerve passes from the brain to the skull bone to the ear, and also any surrounding structures of the facial nerve which can lead to the ischemia or the loss of blood flow to the facial nerve can lead to facial nerve damage. Surgical procedures like mastectomy, parotid gland surgeries, ear infection surgeries, or any dental anesthesia may have the higher risk of Bell's palsy. Bell's palsy can be also triggered by an autoimmune disorders. Most importantly, in this new modern era of lifestyle is stress. Stress is a very crucial in the causes of the Bell's palsy. During stress, our immunity loosens its control over the body. Lack of sleep, poor diet, negative emotional thoughts have an impact over the body, where our immune system breaks down and which causes the inflammatory changes and hence can cause Bell's palsy. Exposure to cold or varying temperature changes is one of the risk factors for Bell's palsy. Diabetes, hypertension, pregnancy, leprosy, obesity, and upper respiratory tract infection are with the higher risk of developing Bell's palsy. So I hope this video was informative to you. Do care of yourself and don't forget to follow our channel. Thank you.